During a long or difficult labour, there may be a need for something stronger than gas and air. Midwives in the UK are licensed to administer a drug called Pethidine by intramuscular injection. It certainly isn't their first choice for pain relief, but it does sometimes have its uses, as Virginia knows only too well.
I think Pethidine is not a nice drug. I think that it does have lots of downsides to it. It can make women feel drunk. It has a very strong amnesiac effect. You lose perception of time. And once it's in the bloodstream, you've got to wait for it to wear off. You can't take it back out again. It does cross the placenta. It can make the baby feel be very sleepy at birth and not feed very well. It can necessitate, with some babies, needed resuscitation. So all in all, it's not an ideal drug. However, I do believe that there is a place for it in some labours. I think that some women can benefit from it. I think especially women having long labours, it can give them a few hours of respite. I think it can help them relax when they're very stressed. But it should be used appropriately.
Claire has been labouring for 2 days with very little sleep, and her midwife Virginia feels that Pethidine may help.
Yeah, she's going to have a shot of Pethidine to help her get some sleep. It's not her first choice. She wouldn't have written it as a choice in labour, but it's always best to keep an open mind, and for some women it can help them relax for a little while and get over a sticky period and get on to the next stage. So we'll see how it goes. But she's going to try and lay down on her side, having had some Pethidine, and suck on the gas and air with Tony giving her a cuddle, and we'll see what happens in a few hours. Over the last 7 years, I've probably only used it about 10 times, and we're talking probably getting on for 130 births, so not very often. Most women, if they have a relatively average length labour, don't need it, want it, whatever. Her main priority is sleep at the moment. She needs to sleep. She's been up all night. She was contracting all day yesterday, so she's going to be tired. That's normal. But so her main priority at the moment is sleep, and this will probably help. Basically, when just a woman needs that little bit of oomph to keep going, I think that it has its place. I would be very reluctant to give it to a woman who's had a baby before, because if you give it at the wrong time, it can have very high levels of it in the baby's bloodstream. And a woman who's had a baby before, who's having a second or a subsequent baby, she could be 2 centimetres dilated 1 minute, and the next minute her baby could be born. You can never judge when a baby's going to be born with a woman that's had a baby before. So I'd be very reluctant to give Pethidine to a woman who having her second or third or subsequent babies. But I think it has its place in first labours.